Good afternoon, everyone. We're just waiting for everyone to come in to be admitted. Excellent. I think that's everyone. Don't have anyone waiting. So I'm very pleased to have so many people with us today. And as it's still January, I think I can just about wish you Happy New Year. And I hope you're well and I hope you're keeping safe. So my name is Louise Halfpenny, and this session is going to be all about communication and engagement. And I'm particularly excited about this session because hopefully we'll get to ask you some questions. So I'll just take you through the agenda. If you've joined us before, you will know that we ask for you to remain on Zoom. So you will be on Zoom during the presentation. There will be plenty of time for questions. And I would ask you, please, to let me know you want to ask a question by using the chat function. So that's a bit of a change. And the reason for that is so that I can keep an order of who's asked first. So when the raise hands is used, it's a bit hard to keep track of the order. So if you would just use the chat function, you can just indicate that you want to ask a question, and then I will come to you and you can ask it yourself, or I can ask it for you if you type out the question. So that's entirely up to you. Just makes sure that I can ask people in the right order. So you're here because you're a member of our stakeholder reference group. So we hope that you're going to be with us as critical friends and that you understand that this is a topic on communication and engagement, and that's what we want to talk about in this meeting. So I'm going to introduce Arfan. Arfan Bhatti is our Diversity and Inclusion Manager. And of course, that's so important when we talk about engagement. We really want to make sure that when we are going out to our communities that we're reaching everybody. And we are really now gearing up to do some public engagement on all the changes, all the benefits, all the different aspects that come with looking towards redevelopment and our 3-site model. So lots of exciting things to tell people about, but we want to make sure that we're reaching them in the first place. So the aim of this session, just to outline the plans and talk to you about the clinical strategy and also the clinical brief. And we also want to talk to you about any support or any ideas that you've got to encourage feedback. And we'd like to hear how you want to be involved. Obviously, we know this is a very different time and we can't have the public meetings that we've had before. But if you've got other ideas of meetings, sessions, online, anything that you think of, please let us know at the end. So, as you know, in October, we did agree, the board of our trust and also Herts Valleys, that our preferred option was the 3-site model. So that decision has now been made. So discussions from this point on are not about new site versus the 3-site model, because that decision has now been made. So what we want to do is talk to people about our clinical strategy, which is our ambition for the next 5 years, and the clinical brief. And I think one way to consider these is the strategy is really the why are we doing things differently? What do we want to do? And the clinical brief is more of the how and the where. So the clinical brief goes into far more detail about where services might be provided from. And we are launching public engagement next month. So mid-February, we expect to be coming out to you with some documents, with a survey, and also the architects will be doing some public exhibition probably later on, probably in March. So there's going to be quite a lot going on in the next couple of months. This is an overview of our engagement plan, and we're working with Herts Valleys Clinical Commissioning Group. and we do want to make sure that we capture your feedback and that we'll be building on some of our previous engagement activities. There will be opportunity for broad community and stakeholder involvement, and we are looking at more niche and targeted engagement, and Arfan will talk to you a little bit more about that. So we will still be doing meetings like this. We will be doing more where there are breakout rooms. We are looking at doing a joint meeting with our architects. So there's lots of opportunity to hear, to learn. We'll be doing some short recordings so that you can just learn about different aspects of our plans in sort of bite-sized pieces. So there should be lots of opportunity for you to read, listen, view in whatever way you find it easiest. We have some principles behind our engagement plan. We want to be honest and responsive in our communications, and we want to make sure that we are accountable and we stand up to the test, which is that we have a duty to involve. So we'll identify different audiences and prepare things that meet their needs. So we're already considering translations, easy read versions. That's going to be really important to us. We will deliver core messages. So we always think about, you know, what are the key things we want to achieve. So, you know, you might, if you're absorbing a lot of information from us, you might see the same phrases again and again. That's not because we've run out of ideas of what to say, but we will have some key points that we really want the public to understand. And we will be working in a way that takes account of the Equalities and Diversity Act, and we will try to make our communication with you meaningful. I would like to say about feedback during the public engagement is that we take all the feedback in, but we don't respond to it individually. So we will do that at the end. It won't be an individual response, but it will be a playing back to anyone who wishes to see the feedback. So it's a different way of running things during a period of public engagement. And now I'm going to hand over to Arfan. Over to you, Arfan.
Thanks, Louise. So hi, everyone. As mentioned at the start of the meeting, I'm Arfan Barsi, the Inclusion and Diversity Manager for the Trust. And I think those words, inclusion, diversity, equality, I think we're hearing about them a lot at the moment in the news, in the media, much more certainly than when I first started working in this sector 7 or 8 years ago. So just thought before we go into a bit of detail in terms of what inclusive engagement means in terms of the hospital redevelopment, what in fact does it mean more broadly? And I really like this analogy because I think perhaps we can all relate to it. And we might have been at that school disco, that awkward wedding where we didn't feel as confident to step up, to contribute, and to really thrive in a particular environment. So, and for me personally, and I think when we look at this analogy, perhaps it will mean different things to different people. And for me, it highlights it's not just enough to be present. So when we think about the fact that diversity through the lens of it being a fact, inclusion of it being the act, and really important in order to overcome barriers and improve representation and empower marginalized groups. And thirdly, from the belonging perspective, for me, what it really symbolizes is embedding that psychological safety so that everyone can contribute with ideas and suggestions without fear of negative.
Arfan, can I chip in there? I'm so sorry, but would you mind putting your camera on?
Oh, is it not on?
No.
I've got 2 screens, so they should be able to see me. Oh, maybe the one I'm speaking through is, I think what I've done is I'm speaking through the one where I'm not cameraed. So I'll go off camera, or here, there we go. How about that? There we go.
It's just in case you were doing a really good example of dancing and we were all missing
No,
it.
I think
Okay.
I think I'm doubled up now, but you
Okay.
should be able to see me somewhere. So where was I? So yeah, if we're going to and how that translates in terms of inclusive engagement, in terms of what we have planned at West Hertfordshire hospitals, the inform, the involve, and the embed pillars. I suppose you could look at through the diversity, through the inclusion, and through the belonging lens. So we have gone out over the last few months and tried to inform as many of the community groups and individuals and representatives as possible of the fact this is happening. Secondly, one of the key things as well is in trying to identify some of the key players. So as well as groups, clearly, I think there's a number of people of influence or champions within communities, and I think certainly one of the things that has really been highlighted over the last few weeks as we've tried to roll out the COVID vaccine to as many communities as possible is just how important some of these key influences within certain demographics of the community are in order to reach out to groups. And thirdly, as Louise mentioned a few minutes ago, not just through the lens of different languages, but also trying to make it communication as accessible as possible. I've been working in the NHS for a couple of years now, and I'm always amazed, for example, at the amount of acronyms and some of that jargon, and just trying to make it as clear as possible, really, so that everyone can feel as though they're included and can contribute. And I've mentioned reverse mentoring there as well. It might be a phrase that some of you are familiar with, and I think what that really tries to achieve is almost a disruption of the power dynamic, and enables people who perhaps have less of a voice or are less able or have less opportunities to share some of their experiences, some of the inequalities, to really step forward. So we know, for example, in relation to health inequalities, for example, lesbian and bisexual women are twice as likely to have never had the cervical smear test compared with women in general. We know that, for example, Black women are much more likely to die during childbirth. And I think really understanding those issues, both from a data perspective, but also from a story perspective, so that our senior team on the hospital redevelopment can have that quality of interaction to really understand how that can be reflected into our plans moving forward. And then ultimately, in terms of outcomes, as I said, reducing that health inequalities. And something we're working on at the moment is an equality impact assessment, which really highlights hopefully that audit trail and sets out a clear plan of action, how we intend to ensure that the redevelopment is as inclusive and as effective for the community moving forward. So I could talk about this, and diversity inclusion. It's a huge topic. And if we go into the next slide, please. I think one thing I'd really like to, when I'm looking at yourselves, you are our super activists. It's amazing we've got yourselves here on a Friday afternoon. I'd really encourage you just to go out and speak to someone, obviously with the digital social distancing rules in mind, and perhaps inform them or try to involve someone from an underrepresented or marginalized community to get involved with the plans through the channels we have possible, because I don't think this is going to be easy, but I could talk about this much longer. I'm conscious of time, so I'll stop there, and I'm sure we have some time for questions at the end. Oh, Louise, you're on mute.
Thank you. So I'm just going to talk through the next steps. So quite a busy slide, but it's going to be quite a busy 6 months. So we are in our pre-engagement. We've been talking to some other stakeholders about engagement, so some local authority meetings. We are with the Scrutiny Committee in early February, so we're talking to our trust board and the board at the CCG. So we are talking to a lot of people now saying, listen, we're going out to talk to people in February. Do you have any groups that we can talk to? Do you have ideas of communities that we're not reaching? So that's kind of what we're doing at the moment. The Scrutiny Committee topic group, hopefully you know about that because information went out to all SRG members, and that is a topic group that you can, you won't be able to make a comment unless you have signed up as a witness, but you can observe, and that is a session for the Scrutiny Committee to assess our engagement plans and to look at the rationale for the decisions made by the board. So the engagement launch is mid-Feb, and then we will be busy going to different communities, hopefully going to just different groups. And you know, I can see on the chat I've had one invite already, so that's definitely a yes, John. We will make sure that somebody is there to talk to your group. Thank you very much for asking. And we're going to do our engagement in 2 phases. So what we plan to do is to go out and present information, to talk to people, more sessions like this, and then during mid to late March, what is normally PERDA in a normal year. I know we're still waiting to see if the local elections happen in May, but during that time of PERDA, we would be analysing the feedback, and then we would go out for a second period of engagement because we might want to change what we're saying because some of our messages might not have got through, or there might be a particular concern about one aspect of our service proposals that we might have to reconsider. So we will be doing that in 2 phases. So that takes us through to June, and more review of feedback in June, and then we feed that into the board, because in July feedback is considered by the trust and CCG boards, and the clinical brief is finalised for the outline business case. So for those of you who might have joined a bit later, we've got something called a clinical strategy and a clinical brief, and the brief is the document that really begins to tease out where services go, where things are moving around, and it'll explain a little bit more about why some things might move from Hemel to St Albans or Watford to Hemel. So there's quite a lot of change going on between the 3 sites, and that's what we'll be talking to people about next month and throughout the spring. Next slide, please. There you go. I've always wanted to say that. So different engagement methods, promotion and information. So these are things where we are giving out information. So this is kind of one-way communication where we'll be posting things for people to look at. So you can see the kinds of things that we expect to be doing. And then we hope also that some of our communication will be more two-way. So we'll give you more of an opportunity to get involved. So if we can go on to the next slide. So there'll be some online events, some social media. So we are well, we all are, aren't we, learning better at different social media and digital platforms. We'll be doing another survey. We will have longer this time round, so that will be good. So there will be another survey that's currently in production, and we will be hoping that other organisations will let us have either spots on their virtual agendas or room in a newsletter. And of course, we'll have lots of events for the reference group. So we're going to capture your feedback through online and paper. So we will be producing some paper. We know that people don't want to do everything digitally, so we will be having some hard copy surveys and making sure that there's reading material, hard copy as well. We know that's important. And a point I made earlier, but worth bearing in mind, because I don't want you to think that we're rude when we don't respond to you. It's just normal during a formal engagement that you receive everything in and then you sum it all up at the end. So that's what we will be doing. and we will be logging all the feedback as we get it. We are currently looking to outsource the analysis of the feedback, because that just gives us all just some impartiality, and also it's quite lengthy to do all this work, and it's not something that we're specialist at. So it's much better for us, and I think better for everyone, if we give all our feedback to a third party and they do the analysis. So we're just currently looking at the organisations that offer that sort of service. So I want to ask you some questions. I can see that some questions have come in on the chat, and I will try and answer those, but I would like to remind you that these sessions are for us to discuss the topic. So if I'm brief with those questions, it's because I want to sort of get through them so we can go back to the questions that we want to ask you. So I should just go into the chat function, and if you let me know if you want to ask it yourself, you're very welcome to do so, or if you want me to ask, that would be really useful. So excuse me one moment. Kevin, did you want to ask your question yourself, or are you happy for me to paraphrase the one about Health Watch and the co-production group?
Happy for you to, Louise.
Okay, so just to update, Kevin asked, is Health Watch Hertfordshire involved? They have a standing invitation to this meeting, and they are also going to be attending the topic group in February, and we will also send them, we tend to send them drafts of our materials, because they undertake to read things as a sort of lay reader. So they help us kind of make our communication as jargon free as possible. You might not believe that, but we do try, and we do send things like documents and surveys to lay people. So Health Watch will look at that for us. But yes, they are, as far as I know, they are involved. So I am in touch with them. So yes, they will be looking at what we're doing. And the co-production group, I think, met only a couple of weeks ago. So yes, the co-production group set up by David Thorpe is still going. Do you feel that you've fallen off the list and you want to be put back on it, or?
Just hadn't heard anything. So,
okay.
And also I did mention the other, you cover more than one Health Watch. Are you involved in the other Health Watches as well, like North London?
No, not so much. We have occasionally been with at the East or Essex when there's been something that's been more broader geographical area, but we haven't done. But that's a really good point, actually. So yes, because of course we do get patients from North London. So yes, thank you for that, Kevin. Okay. Kevin, you had another question about digitally excluded people, and we are looking into how we can include something in the appointment letters, which it does actually take quite a long time to get into that process, but we think we can make that happen during the engagement period. So we will hope to be writing to people, so it's not all going to be reliant on people looking at websites. So I'm just going to, there was a question there from John Dowdle about joining one of your groups. So that would be an absolute yes for us. So if you can drop the redevelopment email address a message, and we'll flash it up at the end of this session, then we will find somebody to come to that meeting and run through some slides with you about our proposals. So that's great, thank you. And that is an offer to anyone who is part of a group or wants to get people together. So we will come out and, well, we don't have to go anywhere, do we? But we will talk to you, and but we will do it from a point of view, or a point that the decision about the configuration of the hospitals has been made. So we're not going to come and talk to you about the whys and wherefores of new site versus three hospital configuration, because that decision has been made. But we will talk to you about how we see the future. Just having a look at the questions here. Now this is a good one from Glenys, and it's one for you, Arfan. It's about what are protected characteristics. So did we have that on the slide? And if so, could we go back to it? And you can talk through it if you wouldn't mind. So this is, I'll hand to you, Arfan.
Absolutely. So in summary, these are the groups of people who are protected by legislation through direct or indirect discrimination. So direct discrimination is, for example, a policy or procedure which has a immediate and clear detrimental effect to their life or experience in any way. And indirect discrimination is something where in relation to that, which highlights that it could be something where someone is left out unintentionally, and therefore they are legally protected from such issues, and can therefore, for example, seek compensation is one potential outcome from that. So really what the equality impact assessment does is enable us to really think through each of those protected characteristics, evaluate what we're doing from a communication point of view, and establish are we leaving anyone out, particularly from these groups, and what can we do about it. And as a caveat to that as well, I think, well, these protected characteristics provide us with a really good platform and some structure. There are some groups, for example, who aren't necessarily included in this. For example, when we think about carers, for example, and also socioeconomic factors aren't actually included in this currently, and obviously that's also at the forefront of our thinking as well. And in addition to that, I know the legality can feel really important, and it's really important, but ultimately what is our motivating factor in relation to this is ensuring that people are having the most effective outcomes from a health equality perspective, and secondly from a when we think about our SRG, and eventually when we get into topical groups and so on, there's a lot of evidence out there which highlights the more diverse and inclusive groups or teams are, the more creative they are, the better problem solving. And there's even for example, lots of evidence from a corporate perspective that they're much more likely to make profits. So in every sense, this is something that is beneficial to us. So while the legals is important, I think our motivating factors is the stuff I've mentioned, but happy to provide more information and more clarity on that if necessary.
Thank you, Arfan. And I know from the from talking to the council and talking to other public bodies, they also think that working class adults, working age adults, are hard to reach, or seldom heard. So that is something that I know the council will ask us about working age adults. Obviously, it's a little bit easier now because a lot of people are working from home, but it is quite difficult sometimes getting hold of people who are so busy during the day, and then they might be going home to busy family lives. So we are going to try really hard through social media to reach some of those working age adults, because we're not sure that we're always getting them involved because they're so busy working. So that's something we're going to be looking at as part of our public engagement. I've had a question about the independent analysts, and I can't answer because we don't know, we haven't appointed them yet. We'll be doing that next week, and provided they're happy, which I imagine they would be, to say who they are, we've got no problem with saying who we're commissioning to help us with that piece of work. So that's absolutely fine. As soon as we know, it'll be on our information. Oh, there was a question from Deepa, which is one for you, Arfan, which is what we've been working with you on, which is how we're going to reach our ethnic minorities in the area.
Yeah, so we've done some really good groundwork with people like the Watford African Caribbean Association and others for example, local faith groups as well. You know, I'll be completely honest, it's been quite challenging in terms of getting those the outcomes in terms of some real quality engagements. I think there's been some really good initial conversations, and I think moving forward that's something we're going to have to work you know, a lot harder on. I think one of the key things, I think in my experience as well, is you know, if for example you know, from a representation point of view, if they're less likely to come to us, you know, how can we go to them? And hopefully as we, you know, move out of the you know, the pandemic and in future, there'll be certainly more opportunities to do that, as well as potentially have joint events as well. But you know, I'd be really welcome to hear any suggestions about how we can get better at that, because it's definitely something we're going to have to continue and not get complacent on, even if we do achieve it. And significantly as well, I think, for example, what we're finding with the as an example with the COVID vaccinations currently, as well as the differences within BAME demographic as well, and that's something that is really important, understanding the nuance in West Hertfordshire. And looking at some of the data this morning, I think there's some really good stuff that gives us a good platform in relation to some of the health inequalities to go in and have a clear hook in terms of what we'd like to talk to them about. And again, maybe the topical groups will provide us with some more structure in relation to that.
Thank you, Arfan. Thank you. I'm going to just carry on going through the chat function. I see there are a couple of people who've raised their hands as well. So Chris and Jenny, I will come to you. I just did say at the beginning that we can't always keep track so well with the raising of hands in terms of the order in which people have raised hands. But Chris, I think I saw yours go up a while ago. So I'm just going to take a couple of these questions and then I'll come to you. So a question from Margaret. Do you want to ask it, Margaret, or are you happy for me to tell people what it is?
I'm happy for you to continue, Louise. Thank you.
Sure, thank you. So this is about how will the digitally excluded know about this? Good question. We do work with local media, so we hope that maybe through local newspapers or local radio, we will get messages out. So we have to think quite hard about that, because people also aren't going to libraries and different places where they might pick up information. So we will still be using the traditional media as well. And you know, local newspaper readership is, you know, it's not bad. It doesn't have the greatest reach, but it is one way of reaching people who aren't looking at their phones or on laptops or other devices to get news. So we will be trying that way. And I'll come to you, Fiona, now, and then I'll come to you, Chris. But Fiona, did you want to ask your question, or I will read it word for word if you want me to, up to you.
I'd like to ask it, please.
Of course.
Activate my camera. Can you see me?
Mm-hmm.
Many people in the quorum feel that they're being discriminated against because of their geographical location, invited to the party under sufferance, but not asked to dance. So how can the residents of the quorum be made to feel that they're being treated equally with residents of Watford?
Sure, thank you. Thank you. Can you hear me all right?
Loud and clear.
Good, because I've just got a strange
Your phone.
I'll try again. Oh, that's better. Great. I don't know what happened. So yes, Fiona, I can understand how that might be because of the services that have moved from the hospital in Hemel, and you know that Watford is now the centre of emergency and specialist care. So we do completely understand that. I hope that when our plans and our proposals are out next month, that people will want to talk to us about what's going on at Hemel Hempstead Hospital, because we think it's really important. The three hospitals are going to work very differently, and not just for people local to the hospital, but people in Watford and St Albans will also be going to Hemel Hempstead Hospital. It's going to really change its focus, and very much be a centre of excellence for people with long-term conditions. And already we run our amazing virtual hospital service from Hemel. So I know the site looks a bit tatty, and we know we need to do something with that, but it is going to be a lot of refurbishment and some new building as well. So although it might not be what people want or what people once had, which we wouldn't re-provide now anyway for reasons of safety, we think that Hemel Hempstead Hospital has a really important part to play, as does St Albans, as does Watford. We're looking at them very differently. It's not a poor relation. It's going to be a hospital with a unique purpose in its own right, and we're going to work on the site, and hopefully some of that land also will be regenerated. So it will look different, it will look more inviting. And our clinical teams are really excited about ring fencing some of their resources, having some really good diagnostic facilities. So I think, although it's not going to be the hospital it once was in terms of range of services and the emergency services, I think it has a really interesting future, and it's going to be a really important part of our sort of trio of hospitals. So what we hope for is a warm welcome to come and talk to people in Dacorum, and that they accept us on the grounds at which we come and talk to them, which isn't about making it what it once was, but it's about looking at the future of that hospital. So we'll keep coming to Health in Dacorum until you tell us not to, and we will hope to talk to people about the future of their local hospital, as we will do in St Albans and as we will do in Watford. And anything more, or any other groups you think that we can get into, we would really appreciate that. And we really hope that people can come to us with a starting point from here, and not always the past, because we will just never move on if all we talk about is what was once at Hemel, because it's not going to return to how it was. Emergency care doesn't work like that anymore. So it's got to be, I think we've got to be able to go with a bit of a welcome to talk about the future, and that would really help, I think, on both sides, if you could all be forward looking. But if you can line me up with any invites, I and my colleagues would be very, very grateful. So yes, we'll take the brickbats and the bouquets, but we do want to have a good open discussion about the future. Chris, sorry, you've waited a long time. Did you want to ask your question now? Chris Luff.
Yeah, mine was going back to Arfan's presentation around EDI, which I've already sent them a message on. Is we're working on a project with Watford Football Club and the young generation of this Kickstarter scheme. There's lots of young people and young apprentices that want to be involved and have a voice, and so they're doing several articles. So we'd like to come and interview you about your policies and spread the word if we can.
Yeah, that sounds, I think, as I said in the message, Chris, that sounds really, really good. I think as many channels as possible. I think with the demographic, particularly from a young perspective, how they access information, and what we're aware of that is ever changing. And I think the more methods we can do that's the better. And I think is something we're trying to reflect in our plans. And this morning as well, I was having a conversation with someone from the CCG and understanding, I think, what you'd might brand the media outlet you mentioned in terms of specialist media, and perhaps that or local media, and that would definitely come under that category, and something where we're trying to understand more where these publications or pockets are, which we can access. So yeah, that sounds really, really good, Chris. Thank you.
And the other thing that I put in the text, the chat box there, is that we have a team of, at the moment it's 8, but it's growing rapidly, of young people that are social media savvy and digital savvy. They're already, we actually hosted an event for the Hertfordshire University online the other day, and they've started something called the Next Generation Network of Young People. So if you wanted their views on the whole subject, and to help with media presentation and distribution of questionnaires and things, please get in touch, because I'm more than happy to put them at your disposal.
Great, yeah, we'll definitely follow up about that. Thank you, Chris.
Thank you. And Arfan, there's another question that's from Margaret, that is about the BAME groups. And could you just give us assurance that when we're looking at BAME groups, we're looking across the whole area that we serve?
Yeah, I think the census data is slightly out of date now. Sadly, it has been delayed, so we are able to kind of evaluate our representation in terms of engagement across the broad data we have available to us, and reflect on that. And as I mentioned, it's, you know, kind of Dr. one size fits all approach in relation to this. The variances in experiences within the BAME demographic, for example, is something we're really aware of, and evaluating that, and through our representation of groups or individuals is something we can do. I think moving forward as well in the medium to longer term, we would love to capture the diversity of the stakeholder reference group as well, and I think there'll be a few calls to action in relation to that, and that would really enable us to understand particularly the invisible diversity of the group, and evaluate if we need to make any action or greater work in relation to certain groups. And you know, and when we do ask that information from you, you know, that's completely anonymized, and your name will never appear beside any information. But it does really important for us to evaluate that, so that we can ensure, you know, we're not directly or indirectly discriminating, and ultimately achieving the best results for the redevelopment moving forward.
Thank you, Arfan. So we've got a lot of questions and not a lot of time. So I'm going to ask Jen for her question, and then I'm going to ask pick up the questions that are related to communication and engagement. So Jenny, you had a question for us. Did you?
Well, it's a sort of question. It's back again to what Arfan area is. It's about vulnerable people. Now, you're very vulnerable if you haven't got a good command of language, especially if you're having medical procedures done. And I did have an experience of this, because I lived in a country where when I was first there, didn't speak the language. The hospital had volunteer interpreters. Now, they were all police checked and very careful. They had a particular area near the entrance, and it was signposted in a lot of languages to find them. They wore white coats, they wore badges in their own language, saying which was their other language they could speak, or sometimes there were 2 or 3. So people recognized them as being important. They also knew their way around the hospital. They knew how to help people get appointments. They would go in with people for their appointments. They were there. They were mostly early retired people who really enjoyed doing it. I mean, they absolutely did. They didn't ask for anything in exchange except the white coats and the badges. And they were timetabled. You knew there would always be somebody there, whatever language. And I mean, you imagine a European country, there were an awful lot of languages covered. And they were easy to find. People knew who they were. They trusted them because they were, you know, properly checked out and given some training as well. And they were in one station. They could be called on they had dedicated mobile numbers. They could be called on from A&E. They could be called on by a doctor in a ward who was having a difficulty speaking to somebody. The biggest job was with outpatient appointments. Is that something you could possibly consider?
That sounds like a very interesting and innovative suggestion. I'm not sure if we have anything as extensive as that. Certainly we do have a translation service in terms of the written communication that's sent to our patients, and by default, given the diversity of our staff and through teams such as our chaplaincy and pastoral care teams, there is you know, a number of languages spoken, as well as our I think our family liaison line, which helps ensure that despite there not being visitors being permitted on site at the moment, families are able to speak to their loved ones, perhaps alongside the clinical staff as well, when that advice is being given. But that's something, you know, I think perhaps we could have more information on and understand some of the operational details around that. But yeah, that's not something I've heard about in the format you've suggested. So very keen, perhaps we could take that offline and find out more for sure.
Thank you, Arfan. As we're getting quite close to time, I think if you haven't submitted a question yet, we're probably not going to get to it. So I'm just going to go through a few that have come in. I don't know who H is. I know you've sent many. Some aren't questions, some are comments. But if you have a concise question, H, and it's about communications and engagement, did you want to ask it?
I think there's been a few questions there that I've asked, but I'm guessing they're not the questions that you want to answer.
Well, the session is about communication and engagement. So do you have a question on communication and engagement for us?
One of the questions was, if you haven't listened to the fact that we want a new hospital, how can we trust that you will listen to the engagement questions that are being asked now?
Okay, well, we have listened to the fact that people in Hemel Hempstead want a new hospital, or people in other areas. I don't think
it's just Hemel Hempstead. I think it's every area apart from Watford.
Yes, I did say other areas.
Okay.
Because we're not granting you your wish doesn't mean we don't want to keep talking to you and having a dialogue with you. You know, we have made the decision. All the reasons for that decision are there for you to read. We've moved past that now.
I know, unfortunately, though, the decision...
We do still want to talk to people about what we have to offer. I know a lot of people in some areas don't agree with it, but we have to keep listening as well as talking to work out what we can provide at our 3 sites. And the way the hospitals are going to work together is going to provide a really strong network of services for people across West Herts. So we would just ask that even if you don't like what we're doing, that you can keep trying to work with us on figuring out how we're going to make the best of the services that are going to be running, because there are going to be some really exciting developments.
I think it's going to be quite difficult, seeing as the CQC have already said that you require improvement on your use of resources twice in a row. To trust that your use of resources is going to be...
I can, excuse me, but I don't think now is the time and the place. We've come from inadequate. We've done really good. We've got good for
well, that's still
well led.
To be honest,
a lot of trusts. You will struggle to find trusts that aren't requires improvement for use of resources, because it's all related to. It's a very difficult financial thing to explain, and I'm happy to explain it another time. But this is really about communication and engagement, and I think it's really important for those people who feel disaffected because we're not granting them what they really want. That we have to just get past that and to keep talking about what it is that we are going to do. And if you've got any ideas,
well, I did ask a question in regards to how you're going to be looking to make improvements for disabled patients at this current site, because the car park's too small, the access and area is dangerous currently, and you're never going to be able to change that. So that's
So I don't know if you know, but we are building a multi-storey car park at the Watford site, and we'll be looking at parking provision at the other 2 sites, and we are increasing the number of disabled bays. Work is due to start in February or March and to be completed by early 2022. So that is our plan, and it will have lifts, and it will mean that people will come out at a level that is near where they are entering the hospital, so they won't have that steep slope to contend with. So that is definitely going to make a huge difference. Did you have anything else on communication and engagement?
No, that's it. Thank you.
Okay, thank you. Let me just see if there are another couple that are easy to deal with in the time that we've got. Yes, a lot of people are saying Facebook. So We will do more on Facebook. We will look into that. I think the way our Facebook page is set up is quite limited, so I think we have to understand a little bit more about that. There are reasons why Facebook is not always the easiest channel for us to use, but we can definitely look at that. Joan, yes, shuttle bus. We are going to have a travel and access group set up, so I'm sure you're going to be joining us. So we'll probably go around that loop again, just to see if there's anything new or different that's changed that could make that viable. And Margaret, can I ask a question about engagement or a suggestion? Did you want to go ahead?
Okay, thank you, Louise. Yeah, my question is, I know that it'll be partway through your first consultation or engagement, but all councils in the area will be issuing council tax demands, letters, information. Is it worth having a conversation with all the councils in the area to see if you can have a flyer input in with their council tax letter, if that makes sense? So that would be a way of communicating with everybody in the area that serves the hospitals.
Lovely. Yes, great. I mean, and that definitely still goes out in hard copy, does it?
Well, yeah, because obviously you have to be able to contact everybody, and the only way you can definitely do that is post it through their letterbox.
Yes, yes. Okay, yeah, great idea. Somebody also asked about paper, and sort of from coming at it from the other angle, was worried about us producing lots and lots of paper, which is understandable. We will be doing some leaflet drops because that's part of the planning process. So there will be some leaflet drops, probably around Watford area. There may be some later on in the spring around Hemel and St Albans to inform people what's going on at the local site. So there will be some paper, but that is normal for a hospital when it's applying for a planning application. But that was a really good idea, thank you. Oh, and how can you access the Scrutiny Committee topic group? So I am absolutely sure that before the Scrutiny Committee topic group is held, which is on the 8th of February, Monday the 8th of February, that there will be a link on the County Council's website. And if we've got the link, we will share it with you as well. But it hasn't appeared yet, I don't think, because they haven't put their papers on their website. So once they've got everything ready for the topic group, they will probably put the link up. And I'm fairly sure that for that session, because it's a meeting in public rather than a public meeting, that you will be on mute. So it's a session that you can observe, but just keep going back to the County Council website, and I'm sure it will be on there in the next week or so.
Louise, can I just jump in there? You said earlier that you'd circulated an invite to that topic group to members of the SRG.
Yes, yeah, and you're saying you didn't get one, Steve? No.
And the deadline's already passed for making a submission.
Yes. Can I just have, for those of you that I can see, because we used the email address, did anyone, could you put your hand up if you didn't get anything? So there's a few. Yeah, okay. We will definitely check that.
Well, if the deadline for comments has passed, there's not really much point, is there?
No, I know, but I would like to double check, Steve, just what happened there, because we did.
Can I just explain to people the purpose of the topic group? Because you said it was to kind of back up the plans you've got and to engage and communicate, but that's not my understanding of the topic group. My understanding of the topic group is it's been called by people because Hertfordshire County Council have a statutory authority to refer the decision that's already been made to the Secretary of State. And that's why the topic group has been asked.
No, that's not correct, Steve. It has three purposes. It's looking at three areas, the topic group. It is seeking to understand the rationale for our decision, whilst not asking us in any way to repeat the decision. It wants the committee want to look at the rationale. They want to understand what engagement we are carrying out, and they want to consider whether we carry that out as engagement or as public consultation. And those are the 3 points that the committee has asked the topic group to look at. It isn't about referring us to anyone at this stage. So
you're right.
Those 3 points are what the topic group is going to discuss. And, you know, we will make sure that we put the link out for people who want to.
Yeah, those are the 3 points at the moment. And you've done a good job to ensure the scrutiny won't look at the greenfield sites. But I would just not make your mind up on that one at this stage, everybody.
Sure. Well, I invite people to look at the papers for the meeting, and also to observe the meeting, and then the committee after that will publish their findings, and that will be in the public domain for everyone.
Okay, so you're going to make sure that the members of the SRG, actually everybody who's registered, has actually received that communication for you. Is that right?
Steve, I said I would just check what had happened, because it looked to me like some of you hadn't got the message from the county council, so they asked us to send it out via the SRG group. So I will just double check what happened, but it went out in other ways as well, because obviously the council don't rely on just us. They have their own methods, and I know that people have applied to be witnesses at that session, so clearly the messages have been getting out. They don't, as I say, they don't rely on us and as a channel for them solely. They have many other ways to get messages out to the local community. But I will double check if an invite did go out to this group. That was our intention, that we would alert people to it.
Thanks.
So I set my alarm because I'm terrible for over talking, and you've probably all got other things to do. I just wanted to say thank you. I'd like to just ask you to look at these questions again and think to yourself how you might help us. We asked you to join in or form an SRG to be our critical friend, and to help us talk about the proposals that we've got. So if you do have any thoughts, you can email them to the redevelopment email address. That would be great. So thank you very much for your time.